Hello, this is Kim McAllister, and we are moving on to part 2 of our respiratory drug chapter. We are going to talk about anticholinergics. Anticholinergic drugs work by blocking the action of acetylcholine. Acetylcholine is the neurotransmitter that is released in order to stimulate the parasympathetic nervous system. When the parasympathetic nervous system is stimulated, then the bronchioles will constrict, among other things, and that causes the airways to narrow. So anticholinergics bind to the acetylcholine receptors and keep acetylcholine from binding and stimulating the parasympathetic nervous system. So because the bronchoconstriction is prevented, the airways will dilate. ATROVENT is one of the oldest inhalers and anticholinergics used for this problem. It has been around a long time. If patients tell you that they can't take it because of peanut or soy allergy, let them know that the propellants have changed, and so those are available for use. As always, the provider will determine whether or not they take that. Spiriva Tritropium is the newer anticholinergic, and there are 2 others as well. But they cause airway relaxation and dilation, and they do that indirectly. They do not cause direct stimulation of and dilation of the bronchioles. So because of that, they are used for a preventative. This is a maintenance medication. This is not a medication that's used in an acute asthma attack or acute bronchospasm. As always, anticholinergics cause dry mouth, nasal congestion. They can stimulate the heart. They can cause GI distress, headache, coughing, and anxiety. And I already said that's the oldest. And they're available as an aerosol and as a multi-dose inhaler. And usually the patient takes it twice a day. The next medication we're going to discuss are xanthine derivatives. These are plant alkaloids. They're found, it's caffeine and theophylline are the most common. Only theophylline is used as a bronchodilator. We'll talk in a moment how caffeine is used for infants with respiratory issues. The synthetic xanthines are aminophylline and diphyllin. So xanthine derivatives work by increasing the levels of CAMP, and it inhibits phosphatidylase, and that's the enzyme that breaks down CAMP. So when the CAMP levels are decreased, then the smooth muscles will relax, the bronchioles will dilate, and you have an increased airflow. And so this causes a relief of bronchospasm. It also causes central nervous system stimulation, and quite a bit of it. Because of the stimulation to the heart, it can cause increased contractility and an increased heart rate, and this causes increased output and increased blood flow to the kidneys, and so that can increase the glomerular filtration rate, which causes the diuretic effect. So it's indicated for patients who are having problems with asthma, chronic bronchitis, and emphysema. It will dilate the airways. It's used in mild to moderate cases of asthma. It is not used for management of an acute asthma attack. It's an adjunct drug for COPD. Xanthine derivatives, the xanthine derivative theophylline or aminophylline is used in status asthmaticus when other medications do not help. The other side effects are nausea, vomiting, and anorexia. It can cause GERD, gastroesophageal reflux, when patients are sleeping. It causes disruptions and arrhythmias and palpitations of the heart. It increases the urination because it's increasing the urinary output because of the increased glomerular filtration rate. It can also cause hyperglycemia. Caffeine can be used without a prescription, and sometimes students will use it to help study. You may be using some of it now to help you get through this presentation. It's also used in infants as a cardiac stimulation, and it also will help enhance the respiratory drive in infants. Theophylline is the most commonly used xanthine derivative. It comes in all sorts of dosage forms: oral, rectal, IV, and topical. It is used IV for patients in status asthmaticus, as I talked about. This is after they have not responded to epinephrine. The reason it's not used, this used to be used all the time. When I first began working as a nurse 30 years ago, everybody was on theophylline that had respiratory issues. But the problem with it is that it interacts with a lot of medications. It's difficult to maintain and achieve a therapeutic level. This is a medication that has to reach a certain therapeutic level and then be maintained. And because there are other medications that will relieve the symptoms effectively, it's not used as much anymore and is generally only seen in status asthmaticus. Thank you very much, and we will move on to the next set.